On. Good evening, everyone. I hope you can all hear me, please.
Yes, we can.
See you could carry me. I'm starting very shortly, please. On. Good evening once again. Can anyone hear me, please?
Yes, I can.
Okay, fine.
Yes.
That's fine. So, my name is Shegun Adele, and I'm a team member of the Graduate Research Clinic. The Graduate Research Clinic is a multidisciplinary network of postgraduate students, senior academics, and research fellows spread across Africa and the diaspora. The GRC, as popularly called the Graduate Research Clinic, has two core aims. The first one is to provide a brainstorming platform for graduate students and scholars interested in the adaptation of research for innovation and development. While the second one is to provide a mentorship platform and interdisciplinary technical support group for students and scholars across Africa. So the GRC has a number of research activities, of which today's GRC series is one of them. The Roundtable series is one of GRC's intergenerational mentorship initiative to celebrate the scholarship of outstanding African intellectuals and scholar practitioners whose ideas have impacted the society in substantial ways. Today's discussion is being organized to learn, for us to learn, of course, and also, more importantly, please, to recognize the outstanding achievements of Professor Olugbenga Mokuolu in the fields of neonatology and malaria, and in many ways he has used his expertise to positively impact Africa. So we've held similar roundtable discussions for outstanding scholars, the likes of Professor Francis Ebokare. He's the past president for the Nigerian Academy of Letters, and also for Professor CBN Gogo. He's currently the director of research at the Nigerian Army Resource Center. And as a way of bringing it to our attention, please let us kindly type in our name and affiliated organization in the chat box. And also, if you are not
Sorry, good. Okay. I'm not sure if Mr. Shegun is still speaking, but if you are, just to let you know that you're muted. So you might need to unmute for us to hear you. Yeah.
Oh, sorry for that breakup, please. Were you able to hear my last sentence, please? Hello, sir.
Yes, please. I think I heard when you said.
I was trying to share a video now. Please were you seeing the video, please?
No, I think we lost you when you, or I lost.
Come.
Where is it? Where is it? What's it? Where is it? The napkin, where is it? Okay. It's correct. That's what I'm looking for.
Oh, sorry, sir. Check for the break. For that.
Well, since your line is clearer, can you go on to the next item while things are sorted out?
All right. Thank you, sir, and good evening, everyone. Thank you for joining this special edition. And on the line of agenda, we have a short clip to play about Professor Mokuolu's career progression. I think there's technical glitch while we're sorting it out. I'll just take the next line of item on the agenda, and it's my singular honor to share with us the objective of this roundtable. And I've been given a privilege also to talk briefly about the person of Professor Mokuolu before we take the few topics that we have. So I'd just like to read out why why this event was put together. Number one is just to celebrate a scholar. We want to celebrate a scholar, Professor Mokuolu, and his achievement and significant impact he has made in the society, both local and global, as well to recognize his outstanding contributions, most especially in the field of neonatology, malaria, and public health, and the many ways in which he has used his expertise to positively impact the society. The number 3 objective is to bring together a select group of scholars, students, researchers, educators, and community leaders who have been inspired by his work and who share his passion for promoting knowledge and making a difference in the world of science, social science, medicine, and public health, as well to provide an avenue for Prof to share his thoughts and insights with the participants who are eager to learn from his experience and expertise. And lastly, to provide an occasion for Prof to reflect on his own accomplishment. So these are the 5 objectives why this roundtable is put together. I still have about 2-3 minutes to talk generally. Of course, we'll be listening to we'll be having a discussion around his contribution in the aspect of malaria control that will be taken by Dr. Ayotade Omotosho Juawo. We'll also have the privilege to also listen to his contribution in advancing neonatology, and most importantly, keeping the best hand in the country. Prof also has a way of, has a belief that even where, right in Africa, and most especially wherever you are, you don't need to leave the shore of the country before your impact is felt. So we'll share, that perspective from him. That will be taken by Dr. Olayinka Ibrahim. And all these discussion, each of them will have question and answer to reflect on what we listen to, and then allow Prof as well to make comment and give and express his appreciation. And that will be the flow of the roundtable discussion today. So I've given the objective of the roundtable. I still have about 2 minutes to just talk generally before we, go into how Prof has contributed to neonatology, malaria, and his view about using your skills in country. Let me just use this moment to say 1 or 2 things, and you're free. I'm sure you might not be able to speak to Mike, but you're also free to drop. I'm sure most of us have in one way encountered Prof. It's a moment to drop something. Please, I'm reading the chat. Can you mute your mic, please?
Sorry.
If you can hear me, kindly mute your mic. And so we just have 5 minutes to share individual encounter that you may have with Prof. We will get into the scholar, it's academic contribution, but I don't know if you are here this evening and you have an encounter with Prof that you cherish so much. This is the time to, roll it out, and I'll be glad to read them out why I share my own personal experience with Prof, which I cherish so much. Yes, my name is Afolayan. I didn't study medicine in Lawrence, so you may be wondering, so how come? What is the link? How or when? What's this link between Afolayan? I study physiology. Then I went on to study cognitive neuroscience. But I think it was a burning desire for me to see people in basic medical science, those, graduates of anatomy, physiology, to also find a place, to express their talent and contribute generally to health sector. And I'm one person that is so passionate, about, of course, I have background as well in physiology. And we started Christian medical science, basic health foundation, to promote excellence, in basic medical science, and also promote Christian values. And it was at that moment when we were trying to put our objective together that I was referred to Professor Mokuolu. And, meeting him that day, I was so passionate, talking about the vision, what we want to achieve, and most importantly, putting the timeline. I was so specific. If you are, if you've been attending conferences, you must have heard about, having a SMART objective, so specific, measurable. And so I was, I put my note together before I was talking to him that day. And when he listened to all that I described, his response till tomorrow stick with me. And I'd like to share that briefly. I'm still waiting for all of you to share your just one key thing, memorable encounter you have in the past with Prof. I'd like to read them out before I bring my to conclusion. And Prof said to me and said, Oluwole, there are two mountains. I said, this philosopher now, they are coming again. I'm very, pragmatic, always in front. And Prof said, calm down, Olu, there are two mountains. I said, okay, let's know them. He said that there's mountain of revelation. I said, okay, and then mountain of experience. There's mountain of revelation, and then the mountain of experience. And he told me that day that these two mountains are standing side by side. He also made me to understand that with the level of vision and the drive and the way I have described, what we're how to do, that it appears as though we have climbed the mountain of revelation. So we know what we want to do. It's so clear to us. It's like we should just make it happen sharp. And he said to me, well, you have to come down from this high mountain of revelation and start climbing the mountain of experience. Let me break it down for you. In a very subtle way, communicated to me, and I got it very clearly that day, that we need time to build capacity. We need time, to, yes, you may have vision, it's so clear, but you also need to acquire the necessary skills, which will come with time. Personal growth, being deliberate to acquire the necessary skill in order to see your vision, being materialized. So seeing vision being materialized is that mountain of experience. So it will get to a time where, you're standing at a point where you're clear about the direction, what you want to do, and then you come down from there to acquire the necessary training, the necessary experience, the necessary tutelage that will, in a form over time, have developed your capacity in order to do that which you have in mind. And for as many that are close to me, that, words of wisdom stick to me, and I'm using it. I'm very intentional every day. I keep that goal, ahead of me. And I always remember Prof. I say, okay, I think I'm now climbing the mountain of experience now, and sooner or later, he will see the product of his
That's-
cancer. So that's my personal encounter about Prof. I want to give one or two people privilege to say one or two things before we move to our speakers, that will pilot the discussion for us as highlighted in our agenda. So let me give you one more opportunity to say one or two things about Prof. Anyone? Okay, maybe I need to say that it's not just an academic scholar, he's also a priest. Many of us know him as a marriage counselor. Yeah, he has mentored quite a lot of young people, and there's a lot of dimension. We have quite, a dimension, to Prof, depending on the side that you want to talk about. But for this moment, we'll dive in straight to what we have on the agenda. And I'm sure at the end of this discussion, for some of us that are on the mountain of revelation, it will, move you forward a bit to your mountain of experience. Thank you so much. So without wasting much time, I'd like to just call or move to our first discussion today.
Hello, sir.
Yes, please.
I was hoping you could play a video of the citation, please, sir, very briefly.
Okay, yeah, if it's ready, yes, let's have it. Let's have a citation of Prof. Yeah.
If you could hear me, sir. Hello, sir. I'm Mr. Flyer, sir.
Yes, go ahead, please. Yeah.
Okay, I'd like to share a citation before the next speaker comes on board. Thank you.
All right. Yes, please go ahead and present the citation.
location is very important. Then for the testing too, I think the only way that brought out the look at the slide, the letter was small.
Sorry, Olayinka Ibrahim, can you mute your mic, please? Olayinka Ibrahim, can you mute your mic, please?
We ask that using the line listing, create a table that summarizes clinical features of the cases. Clinical features.
Juliet, if you can hear me, kindly mute your mic, please.
Someone said about
great, yeah.
Sorry, please, were you seeing the video the other time, please? Hello, sir.
There was no audio, but we were seeing some of the video. I think we can proceed. We can proceed. Let's just.
Hello, through the chair. Hello, through the chair. Please, can I recommend we allow Prof to speak? As soon as Prof speak, we will have the citation clearly manifest itself. I recommend to save time. Thank you.
All right. Thank you so much, and apology for these technical glitches here and there. We have a line of item on our agenda. There's an appropriate time for Prof to speak. And I think we'll just move on to the next thing on the agenda. And later, Prof will respond appropriately. I hope that's okay for all of us so that we can manage time very well. So we'll be moving straight to the first discussion today, just for about 10 minutes. And this will be taken by Dr. Ayotade Omotosho-Ojuawo. Just to give us a snippet about lessons learned from Professor Olugbenga Mokuolu, effort in malaria control. Dr. Ayotade, if you can hear me, please, you have the floor. Thank you.
Good evening, everyone. Can you hear me?
Yes.
Yes, please. Yeah.
Okay, brilliant. So Ayotade Ojuawo, like you all know, I'd like to thank the organizers for this opportunity to talk about Prof. It's a very good thing to be able to honor him and talk about the things he has done. I'm sure that we can spend the whole, the entire day talking about Prof. But because of the constraint of time, I've got about 10 minutes to talk about Prof's contributions to malaria. Like somebody rightly mentioned earlier, Prof has so many sides to him. So if you mention Professor Mokuolu, some people will talk about malaria, some people will talk about neonatology, other people will talk about the church. So it depends on the side you're talking about. But for the purpose of this program, I'll be talking about the malaria side of Professor Mokuolu. Thanks once again for this opportunity. So I'll be sharing my screen. Let me know if you can see my slides and then we take it from there, if that's okay. Can the host please enable us to share our screens? I think the host should be, okay, yeah.
You can share them.
Yep. Let's see. I am trying to find my slides. Give me a second. Can you see my screen?
yet to come up?
It's not sharing. For some reason.
Can you click on the share button again?
Yeah, I've done that. It's not sharing. So I've clicked on the share button again. Okay, brilliant. Found it.
Okay.
So can you see my screen?
Very clear.
Yes.
Oh, yes, sir.
Yes, ma'am.
Okay, so I'll be talking about malaria control, lessons from Professor Mokuolu's pioneering efforts. So basically my slides will be an interplay between what Prof has done in terms of malaria control and the lessons we can hear, we can learn from Prof's contributions. So first of all, I'm sure many of us know Professor Mokuolu, but let's talk about who Professor Mokuolu is. So he's currently a professor of pediatrics at the University of Ilorin since September 2011, and with malaria and neonatology as his main areas of research focus. So Prof is a research person at the West African College of Physicians. So he teaches neonatology as well as malaria. He's an examiner and is involved in primary, Part 1 and Part 2 fellowship examinations. So basically his specific contributions in neonatology, which my colleague will talk about, include newborn anthropometry, neonatal infections, perinatal malaria, and general care of the newborn, with a focus on addressing the challenges of newborn health needs in a developing country using appropriate technology. I'm sure Dr. Arinde will elaborate more on this. So in terms of malaria, Professor Mokuolu has contributed extensively to programmatic and policy issues on malaria at institutional levels, the national level, as well as the international level, which I'll be elucidating as we go on. So he has played key roles in malaria case management, malaria treatment guideline development, as well as provision of technical support for Global Fund proposal writing. So regarding capacity development, on malaria case management, he co-developed the framework for adaptation of the WHO malaria case management training manual, both for the global and regional training. I'm sure we can all agree that Prof has been quite involved in things related to malaria. So what are his malaria policy related activities? He's a member of the technical expert group that drafted the first ever WHO anti-malaria treatment guideline, and this was released in Geneva in January of 2006. He facilitated the inter-country training of teachers, training of trainers on malaria case management involving senior health professionals from different African countries. Professor Mokuolu has also served as facilitator of many training programs across Africa and indeed internationally. At the national level, Professor Mokuolu was the former technical director of the National Malaria Eradication Program. He also assisted in the formulation of the current National Anti-Malaria Treatment Policy, Anti-Malaria Treatment Guidelines, and Guideline for Management of Malaria at the PHC level. And he directed the national and zonal TOT on malaria case management, and this produced over 1,320 trainers just in Nigeria alone. Professor Mokuolu was the chair of the committee that drafted the communique on change from monotherapy to ACTs in Nigeria. And I'm sure we can all agree that this has significantly improved, the figures in terms of morbidity and mortality, especially of children with malaria in Nigeria. And as the CMAC of UITH back in 2004, he facilitated the change in the management of malaria to ACT. He was pivotal to Nigeria's policy adoption of parenteral artesunate for the treatment of severe malaria. Through Prof's efforts, Nigeria became the first country to adopt the WHO recommendation in 2011. I really must add here that back when I was doing residency in UITH, I know that Prof actually contributed a lot to management of children with malaria. And one of the examples of this is that Prof made sure that we had free artesunate vials to give patients that came in for, severe malaria. And I'm sure this really impacted in, our management of these children, and also significantly reduced their morbidity and mortality. And for this, I'm sure many families and even the Department of Pediatrics is forever grateful. Prof served as a member of the National Severe Malaria Advisory Committee in Nigeria, and he also served as the lead of 3 consultants that facilitated the development of the National Malaria Policy in 2015. I really can go on and on and on and talk about what Prof has done, but it's not just in Nigeria. Prof has been involved in many programs in Kenya, Uganda, Liberia, Somalia, and I'm sure many other African countries. I really can't skip this one because of time. So specifically, I'd like to talk about the annual roundtable discussion that Prof usually holds, which is the Doctors Discuss Malaria, and it's usually held on the World Malaria Day. And this has afforded an opportunity to cumulatively reach about 1,000 medical doctors annually. I've been a part of some of these programs. I know Prof has had some programs in Lagos. He has had some with Ilomsa in Ilori. And even on one of those programs, there was like essay writing for the medical students, to talk about malaria. And this really, made the students involved in malaria management as well, which is quite key for the next generation of doctors coming up. Prof has also actively promoted, malaria policy changes among the professional associations like NMA, PAN, WACP, and several nursing groups. It's not enough to just make policies. We need to trickle this down to, different sectors and different professional associations. And this is one of the things Prof has done. And this has been quite helpful in terms of malaria management in Nigeria. Imagine a professional body like WACP. These people would take these policies to their various centers, and this would also change the face of the management of malaria. So in terms of the lessons, I know we've talked about the lessons as we've gone on. I just want to, bring to fore some of the things that I know that Professor Mokuolu has done. One of this is the Malaria Center that we have in UITH. This is an amazing, innovative, thing that Prof has done. He's built this center in Ilori just for malaria research, and he's the director of the center. And this center has, brought a lot of change. And this is an amazing thing that Prof has done, which we need, to highlight in this teaching. In terms of malaria research as well, we can go on and on. Prof has had so many research papers published, and I'll just highlight some of them. In 2012 to 2014, he was the principal investigator, and experiences with implementation of malaria diagnostic testing at the primary healthcare level in Nigeria, implication for setup. We can't talk about studies without also mentioning the Aquamat study that we had in UITH as well as many other studies that we can go on and on and on talking about. These are other studies that Prof has done as well that I've highlighted here. So in terms of publications relating to malaria, we've just brought some of these publications that Prof has been involved in and has been cited at least 6,643 times. And this is amazing when you think about the contributions to the body of knowledge that, Professor Mokuolu's research works and the impact it has had on the academics. And this is something we need to talk about because it's simply amazing. I also had a quick look at some of the published works just this year alone, and I was able to count at least 7. I'm definitely I can imagine that it might be more than this, but I was able to find 7 just in 2023 alone. So I'm sure that we can all agree that Prof, has really contributed in terms of malaria control to the body of knowledge. In terms of dissertation supervision related to malaria, I can specifically talk about myself. Professor Mokuolu supervised my dissertation. Can you all hear me? Are we together?
Yes,
We can
please.
hear
Clear
you.
and
Continue.
audible.
Okay, brilliant. So Professor Mokuolu supervised my dissertation related to malaria, and maybe this is an opportunity to thank Professor because can we mute our mics, please? Yeah, because in terms of supervision, it was not just the typical supervisor. I can remember Prof spending hours and hours reading my dissertation, even into the night. Sometimes we'll be going through this dissertation, and for this, I'm forever grateful. And I also know that he supervised Dr. Falayon's dissertation that also had to do with malaria and I think AKI in children. I know he has supervised so many other dissertations, not necessarily related to malaria, neonatology dissertations as well. So just not only research, Prof has also been a good trainer to many of us. He's been a good mentor to us as well. He's also been involved in malaria monitoring and evaluation at various points in his career. So briefly to talk about the awards relating to malaria, I just picked this out because Prof has had so many awards. I'm sure we cannot count the number of awards he has had, but I just wanted to bring out the awards relating to malaria. Back in 2010, he was the Researcher of the Year. 2011, first runner-up in the BMJ organized awards for best research publication in 2010. We can all agree that this is a huge one. In 2011, he was one of the 20 people to be recognized globally, in New York for his contributions to malaria. 2017, joint winner for the NLNG Prize for Science. And just 2023, he was also one of the people that received awards for their contributions towards malaria care in Africa and in fact in the world at large. So we can all agree that Prof has been pivotal in malaria control, malaria management, malaria research. So I just brought out a few lessons from what we've talked about so far. First thing I would like to talk about is that before we can create change, we need to be involved in policy making. We need to find ourselves in areas of leadership where we can be able to, make changes, implement changes, and it won't just be talk. We'll be in that point where we can actually create change and make a difference. Prof has been involved in trainings. He has trained even senior trainers as well. And I'm sure this has trickled down to resident doctors, to medical students, nurses. So we all have to be involved in trainings as much as we can. Prof has been involved in organizational change. If you remember clearly, I talked about the things he did as CIMAC in UITH. He also brought the Malaria Research Center to Ilorin. So he's been involved in making changes even in his own primary, what do I call it? His primary place, if I can use that word. He's been involved in teaching, like I said, in mentorship and in research. So in conclusion, I just put this up because when I say this verse, I remember Prof. Like I mentioned earlier, he has many sides to him. So Prof has been very diligent over the years, and that's why we have this opportunity to honor Prof and to talk about the things he has done. So this is also a call for us as individuals to also be very diligent, and in so doing, people would honor us as well. Thanks for listening, and this is my reference. Thank you very much.
Wow. Thank you. Can we give Dr. Ayotade. Give her our flowers. You can go to reactions on the Zoom. Just say something nice. She has really done well. And I love the last slide. Yeah, give her our flowers. Appreciate her effort, in bringing out the most important slide for all of us that are listening. Is actually the last two, and that depicts the lessons we can learn from Professor Mokuolu's efforts and contributions in malaria. I work in Federal Ministry of Health, and I know that until your findings is translated to policy making, you may do a lot of research, but you must be able to engage where it matters. And Prof has that skill to change role, can be a trainer, can perfectly work as a researcher, and most importantly, part of policy making and implementation. Please, if you are not talking, can you please mute your mic? There's a lot of background noise so that we can. Please, can you mute your mic, please? Yeah, thank you. Right. So, quick bullet points. Let's learn to be able to switch. Let's learn to be able to make the right connection, to be able to develop the appropriate capacity, to be able to switch role, where and when necessary. That's a huge lesson for me in person, taken away from this section. Thank you once again, Dr. Ayotade Ojuawo. So we have just 5 minutes in case you want to, you have questions, around what has been presented so far. This is the time to do that. Otherwise, we'll move to the next presentation on the agenda. Anyone, you can signify by raising up your hand if you have question based on what has been presented so far. Okay, thank you, everyone. I guess we can move on to the next presentation on our agenda. And again, we'll see or listen to Prof contribution in the field of neonatology. And this presentation will be made by Dr. Bukola Arinde. Dr. Bukola Arinde, in the next 10 minutes, will share with us how Prof advanced the field of neonatology. Dr. Arinde, if you can hear me, please, you have the floor. Thank you.
Thank you so much. I can hear you. Tade, could you please stop sharing your screen so I could share mine? Thank you so much, everyone, for this. I'm so glad for the opportunity to be here today to talk about Prof, although I feel very inadequate, but I will try my best. Can you see my slides?
Yes.
Oh, yes, please.
Okay. So this talk is going to be in 2 parts. It's going to be focusing about advancement in neonatology and also exploring Prof's contribution to neonatology in both local as well as national levels. As a way of introduction, neonatology, not many people like this field, but it's one of it's Prof's first passion, as well as what he has also indoctrinated into me and has also shared that passion with me. And I can safely say that I don't see myself practicing anything except neonatology. And this is where I find my best joy. Neonatology is a subspecialty that is focused on the care of newborn and babies with medical problems within the first 28 days of life. And advancement in this field has been achieved through a combination of enhanced understanding of the physiology of newborns, as well as improved rigorous sanitary measures, development of specialized units, and technical innovations that has been developed in their care. When we manage newborns, their problems start soon after they are born, especially when they are preterm. And the goal of any neonatologist, and as Prof has always said, is to ensure that they survive and thrive. And these problems are usually because of the intricate challenges that arise because of their immaturity, which is related to their organ system as well as functions. And these challenges become more complex as they lower their gestational age. And anyone who's gone through Prof would know that these are Prof's words exactly. A newborn, you need to make them pink, warm, sweet, and aseptic. In essence, we need to maintain their cardiorespiratory stability, give them good thermoregulatory support, optimal fluid and caloric management, as well as preventing infection or managing them when they occur. Neonatology has continued to make very good progress in the last couple of years, as well as in the last decade. And due to improving survival rate and emerging innovations, the age of viability is also reducing. And this is as low as 22 weeks now in the UK. And although this follows guidelines with the British Association of Perinatal Medicine, whereby they use certain criteria to determine how vigorously to resuscitate these babies. For us, as far as I can remember, when I was on the Prof, we had survivors of babies born at 26 weeks gestation, and even here they have a much better chance of survival with remarkable improvement, considering when you compare them to years ago, over 10 years ago. And the likelihood of survival is further enhanced by creation of specialized neonatal centers. And this has brought discussions about what the outcomes are when we transfer these babies before they are born or after they are born. And for centers which are quite specialized, the neonatal transfer units who transfer babies from either primary centers to specialized centers, and also give care to them during the transfer. And this, we didn't used to have this before. When the baby was born, you had to consider the child's goodwill to either be born in a good place in the terms of having all the equipment to take care of that baby, or in a bad place. And now it's becoming more and more common, or rather the norm, to have these babies, especially preterm high-risk deliveries, born in specialized centers. Prenatally, the combination of antenatal steroids and postnatal surfactants has highly reduced morbidity and mortality from respiratory distress syndrome, as well as secondarily reducing the risk of intracranial hemorrhage, which can occur either as a consequence of their immaturity or the interventions that have been done in their management. Other things such as artificial ventilators have become more sophisticated with newer and more effective modes of ventilation. I think back when I was in the lorry, we did try to do some sort of conventional mode of ventilation, but that has gone quite far now, and a lot of babies, especially preterm babies, are having high ventilation, high frequency oscillation ventilation. And then now we talk about whether you use pressure settings or volume guarantees to create pressures to keep the alveoli open so as to facilitate oxygen exchange. And also, we talk about high flow or low flow oxygen devices. What we're used to back home in the lorry is usually low flow oxygen devices, which doesn't necessarily regulate how much fraction of inspired oxygen these babies do get. But all of these have become more specialized now, whereby you can have high flow, and once you're getting to about 40%, you have to step-up oxygen support to either CPAP or even ventilatory support. Other advancements include optimizing survival by maintaining thermoneutral environment, the use of incubators, and this I'll be talking about subsequently how Prof has also helped to create designs as well as modifications on devices which you could use as incubators and provide a fairly stable environment for our newborns to thrive. Then also other aspects of advancement include the use of point-of-care interventions, including blood capillary blood gas sampling, which can give us a rough idea of the pH, the PCO2, as well as the base excess, lactate, basic electrolytes, as well as PCV of these babies. So this kind of like is a form of micro sampling and helps us to reduce the iatrogenic anemia that will cause to these babies when we take frequent blood from them. Also, use of transcutaneous bilirubinometers to check and screen for jaundice. And also there's also other advances such as Billy sticks, which can also be used to know the levels of jaundice in babies, thereby helping to screen and prevent morbidity as well as mortality from hyperbilinemia, which can occur when there is excessive jaundice. Other advancements also include in the use of intrapartum antibiotic prophylaxis against group B strep, and this has gained widespread acceptance. This didn't used to be the norm, but obviously it's something that has been considered to be significantly important in the management of neonatal sepsis in newborns, especially when risk factors are identified, and then you go on to preemptively treat rather than wait until they become sick. Also importantly is the rigorous asepsis routine and rational use of antibiotics when these babies do develop some infection symptoms and signs. In terms of cardiovascular stability of newborns, there has also been use of direct intraarterial oscillometric measure to monitor blood pressure. And for newborns now, it's especially preterm babies or whatever category of newborn it is, depending on gestational age, there are certain criteria to also determine what level of blood pressure is acceptable and when to use inotropes to support the blood pressures or to keep them stable. So all these are measures which have come into play and is quite significant and very helpful in the management of newborn babies who are quite sick and require significant help. Feeding support cannot be overemphasized, and because even when babies are born and they are probably term and can feed, some of them are so sick that they might not be able to tolerate orally. And so with the use of total parenteral nutrition, whereby you bypass the gut and then give this nutrition through either central lines or which are centrally inserted or peripherally inserted central lines, then these babies can actually get the calories and the fluids that they need. Breast milk fortification and the use of high calorie as well as protein breast milk substitutes has also come into play with a lot of manufacturers already we have different manufacturers with different products, and depending on which one that we find most suitable depends on the mixture also, or what affiliation the neonatal unit has with the manufacturers. So there's quite a big market for that now. Another advancement is the serial cranial ultrasound monitoring for newborns. They can either in preterm babies or in babies who require significant ventilatory support, because in these babies where there is constant change in their hemodynamics, there can be intracranial hemorrhage. And so when bedside cranial ultrasound monitoring is done, this helps to monitor and determine when this hemorrhage occurs, as well as to be able to quickly diagnose and either institute management, as well as to be able to prognosticate when we have significantly severe hemorrhages. So this is just a summary of what the advances are, because like I said, it's a two-part discussion, and I can't even begin to tell you all the things that are happening right now in the world of neonatology. And even if that being the case, I still want to tell us of how Prof has been very ingenious in making his contribution to the world of neonatology locally as well as nationally with us, and also contributing to international papers with topics related to neonatology. Prof, like Tadi has said, is a teacher, a mentor, a researcher, and an innovator. And honestly, I'm quite honored to be able to say these few words about him, even if I still feel very, very underqualified. Specific contributions for general newborn care. Prof's focus has mainly been in addressing challenges of newborn health needs in a developing country such as ours using appropriate technology. While most of what I've said before are occurring in developed countries, we need to be realistic enough to know that we cannot do all of that in our climate. And Prof has been quite innovative enough to do things that will blow your mind, especially when you think about how he has applied it in looking at the physiology of these babies and trying to get results for them in terms of better outcome. Prof has also contributed to essential newborn care intervention publication that has been used in both primary as well as secondary care levels. And this has been to reduce neonatal morbidity and mortality. And I think also, we could also see Prof's work in newborn anthropometry in classifying newborns. And this is especially important for as if you come into a neonatal unit, even I think even as you're writing your pre-round notes, you would be expected to write, this is 17-day-old, either 28-weeker, AGA, or SDA, or LGA. You need to classify them because that for us helps us to prognosticate as well as predict outcome for this baby. And then you're able to know and anticipate what will happen in their care. Specific to neonatal infections, Prof has been involved in several publications concerning neonatal sepsis. And one of them has been worked with for determining bacteremia as well as cultural sensitivity for newborns in our axis in Ilorin. And this has led to the development of local policies and guidelines that is for the management of neonatal sepsis. And this is quite specific to our locality because, of course, sensitivity would differ as you go across region. And so this work was quite important and is still quite relevant to our management of newborns with sepsis in Ilorin, as well as in the western area of Nigeria. He's also been an advocate of consistent hand washing in the neonatal unit. If you go into our neonatal unit, although the last time I was there, I know now we've gone into separately newborn and outborn units, but I remember quite clearly how well separated these units are. And we've got that tank there, even if there is no constant supply from the primary supplier, we've got the tank where the water is, and you have to wash your hands in between babies, before touching babies, after babies. And as we all know, the singular most effective mode of preventing neonatal infections is consistent and proper hand washing. And Prof has been an advocate of this, and this has helped us to keep infections at least to a minimum. And when I see Prof's work and how well he has influenced the neonatal units in Ilorin, I feel very proud to have learned a lot from him. Because even though I've worked in a level 3 neonatal center here, I've worked in neonatal units here in the UK, I still feel that if only they could listen to my prof, get them a lecture on some of these things they are doing, I just feel that they will probably be invincible. But they can only aspire to have the quality of person that we have in Prof, and I still feel proud that we still have him here. Because, for instance, when I look at the rate of nosocomial infections that we have in unit here, and how simple measures such as keeping outborn babies and inborn babies could have prevented that, I just think, well, common sense is not common anyway. Anyways, moving on. Prof has also been very, very instrumental in the care of preterm babies. And like I said initially about incubators, using recycled incubator technique as a cost-effective means of thermoregulatory support in newborns. And he has also explored the effect of the climate as well as the environment on how effectively these incubators also work. So he didn't just stop at just making these innovations. He also went on to find out what are the factors that will affect the effectiveness. What are the ways that we can make things more cost effective and more relevant to our environment. He has also championed the use of improvised CPAP devices for the management of respiratory distress in preterm babies. And I've used this technique severally before I left, and I did find it very ingenious, and it's the effect and the way that it kind of like helps this baby only the parents can understand how grateful they are for some of these interventions. When we see these interventions, it just sounds like something so simple, but the effect on that child, how it improves the outcome, is outstanding. Prof has also contributed to works highlighting extrauterine growth retardation in preterm babies. I think you worked with Dr. Obasa on this one, and I took the tail end of this one to actually try to see the effect of using breast milk in preterm babies and fractionating them into foremilk and hindmilk, just to be able to prove a point that we might need just more than breast milk to be able to achieve optimal preterm growth in these babies. And I know that work is still ongoing, and Prof is still pushing to find out innovative ways of fortifying breast milk so that preterm babies can grow better. And of course, I know work is also going on in monitoring babies, preterm babies post-discharge, to see how they are growing, to see whether they get catch-up growth and how they achieve this, and if there are any neurodevelopmental deficits or concerning outcomes in them. The other thing I know that we do use in the neonatal unit is the use of what's this oil called? Is it the olive oil? I can't remember the name specifically, but that's
soya oil.
Soya oil. We add it to the feed, and that also helps us to help this baby grow. And honestly, when I look at how babies struggle here, and even with the use of all these fortifiers and all this high tech, because the issue with all these fortifiers is that it does increase the osmolality of breast milk, and it can predispose these babies to necrotizing enterocolitis, which increases their morbidity as well as mortality. So you have to strike a balance between them. And Prof has been my mentor in that regard, because it's kind of like pushed that wheel onto me, and I am still trying to see how I can get a breakthrough into providing adequate nutrition for preterm babies so that they can grow well. Other things that Prof has done is co-authored papers highlighting pattern and burden of perinatal mortality. And this has, of course, this is quite important at the national as well as international level to highlight the point of how important it is on the infant mortality as well as under 5 mortality. It's also worked with reports of rare genetic syndromes, and I know that I've had to represent him on one occasion nationally, where I went to present data from Ilorin on our repertoire of children who's presented with us with genetic syndromes as well as malformations. Prof has also collaborated with multidisciplinary teams to report pioneer interventions in cases of some congenital anomalies. An example is the endoscopic repair of choanal atresia by the ENT surgeons here also local to us. Prof, I can't even start on and on and on. And our Prof has been a teacher, and he's been a teacher across all boards, from medical school, postgraduate level, even his mentoring is second to none. I am so honored to be here today, and I'm so glad to be able to talk about all that Prof has done and how he has impacted in my life, as well as in the lives of those who I have also impacted, because it is actually like a continuum. He has also gotten some sort of indirect impacts in other people have dealt with. He's also been an examiner at the undergraduate as well as postgraduate colleges, either as and is one of those probably that some people will say, oh, is either you want to meet Prof or you don't want to meet Prof. You either want to meet Prof because you want to impress him, or you don't want to meet Prof because you don't want to look stupid. But like I said, Prof has been a very great mentor. He's been a wonderful teacher, and I can only say that we keep learning from him every day, and we pray that he continues to be here with us and continue to share his knowledge, experiences, as well as mentorship with us. And I celebrate him today, and I say thank you once again for allowing me to be here today.
Thank you.
Thank you. Thank you. Thank you. Can we appreciate Dr. Arinde? Give her flowers. Very, very impressive. I enjoy the lecture myself.
I want you to
But one thing is clear. From our presentation. It shows Prof was very intentional. Prof was very, very, very intentional. And there's something when you live each day with intentionality, there's almost no limit to what you can do. You can transform yourself, your family, your community, and your nation. I'm not sure if Prof take note of something that she said. If only they could listen to the quality of Professor Mo. Maybe you should start a podcast, a YouTube page or something, so that, by this is just one quick feedback to Professor Mokuolu. We need to export beyond boundaries those valuable insights, impact that Dr. Arinde enjoy while she was in Nigeria. So thank you so much. My time is running fast. So I can only take just one quick question. We have two major things to do from it. So if you have any reaction to this comment, question, please, let's have it now, or we'll move on to the next presentation on the agenda. Anyone? Right. So we'll move to the third. And this is more like our keynote speaker for today. His name is Dr. Olugbenga Ibrahim, and he will be speaking on debugging the Japa bug, drawing lessons from the life, debugging the Japa bug. Right, drawing lessons from the life and career of Professor Mokuolu for mitigating medical tourism and brain drain in Nigeria's health sector. Dr. Ibrahim, if you can hear me, you have the floor, please. Right.
Good evening, the moderator. I'm not sure whether I'm audible.
Right, you're very audible. Yes, you
are. I also tried to put on my video. I'm not sure what I'm showing.
I can see your video.
Okay. Okay, let me see if I can share my screen. But before then, as a kind of preamble, actually, I remain a lower cadres amongst Prof's mentee. Indeed, I feel this work, just like Dr. Arede actually confessed, is bigger than me by so wide margin. Because I'm just like a small thing among the Prof's mentee. Indeed, I'm the fourth or the fifth generations. I'm not. Is my screen very clear now?
Yes.
Yes,
All right.
please. Right.
Thank you so much. So permit me to adopt the already established protocols. And I also, like I said, please, this work is a bigger than me, but I will try as much as possible to fill in a gap that cannot be filled. And let me say that when I saw the topics, I just kept wondering.
I've added something to it.
Can we move to everybody? Or let me see if I can move to everybody. So when I saw the topic, I look at it and I look at the fact that Prof is a man of extremely 100% quality. If he has Japa, what will have become of Nigeria? What will have become of the United World? What will have become of UITH? What will have become some of us? And I'm just wondering that maybe there's a purpose why they didn't Japa. And through this lecture, why the purposes are being fulfilled. And that's what I want to take us through. Where there are overlap with some of my colleagues, I'm going to skip the area, just be very brief. Then concentrate more on the area to which I know that we need to really discuss about. The topic, like I said, the Bucking the Japas book, drawing lesson from the life and career of Prof. Olugbenga Mokuolu for mitigating medical tourism and brain drain in Nigeria health sector. I just want us to really just look at what Japa. Japa is actually a Yoruba word, and just means Japa to run, to live for goods. As the terminology has been coined to define all sorts of migration from Nigeria, usually in the search for a greener pasture. This is a challenge faced not only Nigeria, but most low middle income countries. But of recent, even the high income country are also Japa to other income country. A classical example are doctors, senior doctors living from United Kingdom, heading to Canada and heading to Australia for greener pasture. The word Japa was actually not has been in Nigeria for quite some time, though there's some resurgence in the last couple of years. The first eras of Japan Nigeria occurred during 1970 and 80, which was attributed to the military takeover, as well as the uncertainty in economics. And then you remember when the doctor was sacked during the early 80s. Subsequently, a lot of Japan has taken place, and the UK register indicated Nigeria remained the third highest number of immigrants, medical graduates and practice in UK. And the process, how was this? Within a period of 3 months, can we mute ourselves? Within a period of 3 months, we have close over 300 Nigerians that are just, but no doubt this has impacted on Nigeria. There are factors that promote Japas in Nigeria. Sorry, supposed to move. Usually, average medical doctor want to live for greener pastures, but also the case of failures of governments and leaderships, various insecurity, our poor infrastructure, especially when you work where there is no light, there's no water, this equipment is not working, that one is not working. Also poor remunerations and working conditions. You may not appreciate the problem you mentioned until you speak with a colleague working outside of Nigeria, where they had several thousands of dollars, and you are still struggling with less than $1,000 and still have more or less similar commitment to fulfill. People also leave because of lack of job, especially the younger doctors. When a number finish and they couldn't get a place for them to really work or even do their residency training. The implication is that there are a lot of brain drains. If people like Prof has left, we are sure that that's a bigger brain drain that cannot be quantified. Also, it also means that over time there will be loss of confidence even in the Nigerian health sector, increased workloads, and subsequently with the increase in load, the human being are subjected to error. And there will be a resultant increase in mortality and overall negative perception of Nigeria. Yes, now, what are the lessons we can draw from Prof, sir? First is that Prof is a human being I would call problem solvers, solution provider. Rather than Japa, as far back as when he did his NYSC, when he has said operator, there was no light in the facility. You don't know the comprehensive health center, basic health center. He went ahead and improvised bottle water to make sure this set of children survive. And I must say that he recorded a feast that earned him merit award because of his innovative practice while he was serving, to which the whole 1 year where he served in the comprehensive center in Benue State, there, he didn't record a single mortality. He earned a state NYS merit award. Congratulations, sir. I also say that when he started working in UITH, there are so many critical infrastructure challenges. I'm not sure which generation of nowadays are patient for it. One of them is the fact that there's not enough radiant warmer to warm the babies, and there's no way you can have a newborn unit without this one. He spent countless hours and started with the paramedical engineering to design a fabricated radiant heater. And I'm supposed to say that we are still using most of them today. I still remember a few weeks ago when we had made a case of Malaria tetanus. That is what we are looking for inside the world to put the patients. Thank you, sir, for this innovation. I didn't leave Nigeria. If you had left Nigeria, I don't know. Maybe those babies will have had a fatal outcome. This radiant heater has been copied by many centers in Nigeria, especially when the examiner comes for exam in a lorry there, and they take a picture of it. How did he do it and the rest? And the unique of this radiant heater, sir, is that it has a thermoregulatory. You can set it. Indeed, making it with thousands of naira is far away than more than those called the one who buy with thousands of dollars, because he has it on, so it doesn't overheat. He has a transparent glass to which you can observe the patient. He has a perforated hole for the oxygen, and there's no procedure you cannot carry out inside it. So this is one of the reasons why I believe Prof did not Japa. So some of us that also did not want to Japa, if you look at what we can actually contributed to where we have. And another critical challenge to which people have let Prof live in Nigeria, I wish he provided a solution, was the issue of the incubator. A brand incubator costs about 6 million now. It means the fact that if one breakdown, you need 6 million, and you know how critical health sector is being funded in Nigeria. Together with famous Professor Ipolite, a paramedical engineer at the Imperial College in London, they renovated and reassembled the obsolete old incubator to produce a new one. Its comparative efficacy, and this was produced more than 100 incubators all over Nigeria. This more or less has a positive impact on the survival of newborns, and for consistently 5 years, this was ranked by WHO as #1 interventions in design innovative approaches for low minerals. Thank you, sir, for saving lives of thousands of children through this simple innovation. Maybe, like I said, the reason why it didn't Japan. Another one is the fact that when we look at it, the fact that oxygen is life is one thing we all get as we are talking about without picking a dime. But you may never know until a child needs an oxygen and they cannot afford it or it's not available. He pioneered and developed a single oxygen delivery using oxygen concentrator, and with comparative cheap cost, recovery of cost within 1 year. And this again was copied by other centers, other health facilities. And this has now been a part of the, if you look at the WHO guide for low-income countries, oxygen is now one of the most mandatory recommended remediation, because once you need it, you just need to plug it and the oxygen is being filtered from the atmosphere, concentrated and delivered to the child. This is one of his own pioneer way of saying, we are not leaving this country, but we're going to turn things around. And the same thing for the phototherapy box. Before the eras of the environment that provided the standard phototherapy box, he was one of the people that studies and look at the fluorescent tube, look at the anemometers, and able to cooperate, design a local phototherapy box. That's what we also learned while we are doing a medical student. And this bulb provide efficiency comparable to most of those modern phototherapy. These are some of the uniqueness of Prof that didn't allow him to actually go and head him contribute to. And this is one thing that the day I saw him doing, I see amazed. That can somebody put your individual money to go and build a public place in a public place? Prof single-handedly built this research center with little or no external support. And this research center, everyone that has done research in pediatrics since it established has benefited from it, including myself, because this is why we run our research now at the postgraduate level. In addition to that, this research center, which e-Cigarette built, has also hosted so many international studies. And indeed, there is no time it's not hosting a grant research. including the recently one they are doing on the triple anti-malaria combination therapy among children in the Lorraine. Thank you, sir, again for giving it, because I remember vividly one of our professors. He said after he won his grants, let me quote this. He said he was baffled, where will I host these grants? Professor Wahab of neurology. And he said he ran to Prof and said, please, can I use your space? And he gave him that space. That is research grant, won him so many awards. Thank you, sir, for the opportunity, sir.
Thank you.
This has been highlighted. You can never know, appreciate somebody until every day somebody actually acknowledges this work he has done, merited it. With over 6,000 citations, 18 days on Google Scholar of 24. Implication is that every single of the Prof's publication has been cited average of 24 times. Citation means that somebody has read the work and said, okay, this pod merited being acknowledged as somebody has contributed in that area. And when you look at his H index of 10, he has more than 40% of his papers cited more than 39 times. And his research interest score, when you are a member of ResearchGate, is over 2,000, 2007. In fact, some of us are still less than 300. You can appreciate the gap between all the years. He has more than 100 publications. This is just what I just explained now. Yes. I was going through preparing for this lecture, and I was amazed that as local journal as a tropical journal of health sciences, Prof has publication. I was like, wow, with this your global input, you see find time to really make sure we grow local journal. I think we also say thank you for that one. He has contributed to chapters and books, and he also contributed to teaching manual. One of these, which I read several times, is the Kobe's manuals on malaria. I wish you can still lay my hand on it. I hope there's an electronic copy now. So if there is not, I think it should be produced for wider audience to also benefit.
Motorized activity, motorized transport.
He has also published the Truth Member, and he has directed so many technical guidelines. He has even carried like Dr. Tadia's guideline. Yes, how do you measure scholarship impact? You cannot measure it unless you are published in any of some leading top journals. Indeed, if I get paper in any of this one, I'm going to drink and sip water for some time and go and rest out. Let me drop my pen a bit. He has published in England Journal of Medicine, ranked 6th among more than 20,000 medical journals in the world. He has impact factor 158.5. It means that if a single item you publish in that journal, it has chances of being cited 160 times. He also published in Lancet with impact factor 168, as well as Nature. He has several chapters in the book and technical reports as well. Well, I think, sir, we are grateful, sir. You have mentors. I remember the first time you took me as a son. That was 2005 as a medical student. And it was worthy of saying thank you for mentoring me up to this stage. I'm very grateful, sir. He has supervised and mentored more than 20. I think the last time I counted those that have completed is about 23 or 24. We have so many at various stages. Postgraduates, including fellowship, a PhD, and a master thesis. And I must congratulate Prof that Prof has also promoted professors today. At least from my interactions, we have 4 people that have become professors among those people that Prof tutelage. Thank you, sir, for that one. He has continued to provide guidance and mentoring for other lecturers, including myself and the consultant, our residents and postgraduates and undergraduates. And we cannot talk about August's impacts without actually measuring the leadership and administrative quality. He excelled both in academics and non-academics. He is the chaplain of UIT Chapel for several years. He's the chaplain of the Reman Chapels and has delivered a lot of lectures at the various churches programs. He was the deputy MD, which we call the CMAC, from 2002 to 2026. Most of this period, he brought a lot of innovative approach. One of them is the VIP Watch, which is still in use and coming by other centers in Nigeria to boost the revenue of UIT. Thank you, sir, for that one. It's very rare for you to be a director of university and choose, and you are so found wanting that you have to switch from one to one. That's the case of Gas. He was the director of the Center for International with excellent performance, to which Professor Oloyede did. You can't go. You just have to find. Lead him to change portfolio to also move to Inolorin consulting service after that. And his tenure in Inolorin consulting bring a lot of patentship to A lot of products are from Ilori, including I'm just sure some of us may be drinking Ilori pure water and Ilori bottled water. That's one of his innovative approach. Now the rest and co and so. He has also headed the ICT project, and he has been the National Malaria Technical Director for the past few years. And if you follow it, I think the last one they just released in 2020 projected guideline for malaria in Nigeria. I projected this one because I look at this cumulatively when we added every money that Prof has facilitated to other countries beside Nigeria, inclusive of Nigeria, is about $12.5 billion US. Billion US in terms of research grant, research aid. And this has translated in saving millions of lives that cannot really be quantified. It ranged from as low as 4 million in Liberia in 2015 to was almost 380 million US in Nigeria in 2014. So as high as almost 500 million, which was later regulation 385 in 2008, and it still continued to mentor and support other countries in winning global funds for malaria as well as malaria control and eradication. Yes, one thing I know Prof when I know him is the fact that he has the ability to think out of box for the best out of things. If you take a paper to Prof, the dimension you will look at it, even if you don't want to accept that paper, you don't have a choice than just to fall in love with it. He has been a man which has always tried for the best, right from when he was a resident. I won the Resident of the Year for a couple of years. He also been a part of the Heroes of Malaria earlier highlighted. He was the co-winner of the NLNG Gas Annual Prize 2017. And he has started giving like he used to do. He has instituted Olugbenga Mokuolu Annual Ilomsa Lecture on Malaria that has led to the formation of Malaria Club, Ilomsa Olugbenga Mokuolu Malaria Club. And I'll say that I'm glad I attended the last lectures. This lecture I usually deliver yearly, highlighting the major changes, progress with malaria. Thank you, sir, for doing that one for our coming generations. Distinguished alumni also, he did so well that the alumni of University of Ibadan, where Oga finished his MBBS, I inducted him among few into the Alexa Brown Hall of Fame. At the same year, he was the second to deliver the distinguished alumnus lecture of an edition that is more than 55 years old. That was a very great achievement. He has so many best of best and best and best. He was considered for the best lecturer. Indeed, one thing I see amazed me is the way he takes his malaria lecture. The August malaria lecture is not banned by 3 hours allocated because of credit. It's banned on the least candidate in that class knowing what malaria it is. And if there's anything we are all proud of at the end of his lecture, we all know something about malaria. Thank you, sir, for that again. He has won several awards, including being part of the champions to head malaria along with the girls, which was unveiled at New York in 2011. Among the 20 people whose their pictures are actually those on the wall in the UN headquarters there as part of the champions of malaria. And his landmark paper, which was highlighted earlier, the Aquama paper that turned the global around to malaria, heading defeat of malaria in sub-Saharan country, including the progress in Nigeria, is the Aquama study, where he was the principal investigator for the artesunate among Nigeria study. That study was so good that it led to policy change in WHO within a month after publication. That common, you just have to use the other rule and move to artesunate. And the paper was ranked the best paper in the whole world by the BNBA in 2010, and which he won an award. Sequently to that one, Unilore has to come up with how do we reward it. And he pioneered the best researcher of the year, and for which he also won the awards for his efforts in terms of research in 2020. As the first pioneer winner of the researcher of the year. Despite these excellent academic records, excellent striving for the best, given to the community, he's still an activist. He's the live member of Association of Resident Doctor and a friend of ARD UITH up to date. Indeed, when there's conflict between ARD and the management and it remain all resolved, the person to call is Prof. Thank you, sir, for also still standing despite your busy schedule. Like I said, while we celebrate Prof is multidimensional. Is also a counselor to young couples. He has helped build a lot of stronger family. He has provided a lot of support. He's a team speaker on leaderships, accountability. He has also helped, he's also an entrepreneurship. I help a lot of startups, including hospitality service. If any of us has ever lodged in a lorry, if you have ever lodged in a lorry researcher lodge, he's probably the one the brain behind the idea, to which you want a serene environment where you don't want the structure. You get your 24 hours access to the internet with little distraction. Learning researcher lab is a place to be. Yes, let me go towards the head by copying a few of the speech. Last year, around this time, around October last year, we were in Ghana for the stroke and cardiovascular research training called 3 for research methods in Africa. And Prof is one of our resources. And after everybody, we have more than 15 professors, almost 90% from US, this place, and it was the time of Prof. After reading his citation, comparable, even better than some of them. Everybody was expecting, when I say, I'm being Harvard, I'm being, he said, no. And I want to quote him, with his permission. He said, I'm a pure local brain professor with positive impact. My story has revolved around this. I don't have any foreign trade, but I have foreign output. Thank you, sir, for this. A few weeks ago, no matter how much strong you are, this Japan syndrome has a lot of kinetics. So you just see your friend here and say, I want to Japan, and I was just discussing with him now, guy, I want to leave Nigeria. And he just put the blank fact to me. Some people sacrifice to train you. Your training is through some people's sacrifice. If you go train others, they are coming. I hope the doom will not occur if we all leave. And that statement has really been vibrating my brain, that he made the sacrifice to stay behind to train some of us. So if we all now carry our load and leave, we will train those that will come. And when your relatives are sick, they take them to the hospital, there will be no doctor to see them. Let me end this presentation by appreciating Prof. Mokuolu. I appreciated him for picking me out of thousands of students to mentors, because we are so many, and still providing the guidance. It's possible to leave me alone, but up to this stage, he's still providing mentor. Thank you, sir, for that one. I also want to thank Madam, because I remember
That's a deletion.
By your wines with the chicken when I passed my MBS. Thank you, but you may not remember, but I still remember. And the children too, for providing the environment for God to really thrive, especially when he's not around, and being a worthy ambassador of Mokuolu's family. They are all doing very fantastically in their various endeavor, and I say kudos to you. I also want to thank University of Ilorin and the Teaching Hospital for giving Ogadi the laboratory environment to thrive, and for allowing him to pioneer most of his efforts. And finally, my appreciation to the other co-presenter as well as the member of the. Thank you all.
Right. Thank you, Dr. Ibrahim. Indeed, attitude isn't everything, but it is one thing that can make a difference in your life. When you develop a positive attitude like Prof did, you are content and enjoy life more. You inspire others to achieve more together. You attract people to exhibit the same qualities. You see opportunities in every situation, and you keep pushing until you succeed. You will agree with me that Prof has really demonstrated attitude despite the setback within the environment which he operates. He is able to turn out global output that is now being celebrated. Thank you so much, Dr. Ibrahim, for that well-detailed lecture. Now, I have just 11 minutes to wrap up, and I'll skip the interaction. Permit me to do that so that we can give quality time for Prof to respond to all of the. Many of you may be seeing Prof for the first time, hearing people talk about him, and you want to have your own experience. I know quite young people that have said this Prof that I will listen to him today. So this is a very good opportunity for all of us to listen to Prof's reaction briefly before we put this call to an end. So it's an honor to, now draw the camera to our celebrant, the man with so much love and appreciate, to give us his remark. Thank you, sir.
Well. This is quite overwhelming. I need to first of all, make the disclosure that everybody who has spoken conducted their own individual research. I didn't have to supply anybody with materials. And it's really amazing. Most of what they are saying, they sound like news to me. And I really want to, I want to thank everyone. Let me first of all, before I say one or two things, so I don't forget, let me just front load my appreciation from everybody. I guess I could call most people by their names. The chair of this forum, that is Soluwole Afolayan, a man with very big vision and very big dream. It was interesting that he can recall that encounter that we had before. I want to thank you and your team. It's quite a crew of people that have been working together. If there were any issues that you have all seen today, it is not because of failure of preparation. This team has put this together almost over the last 2 months with very diligent attention to so many things, but these things just play out the way they play out at times. I want to thank all the academic children, as it were now, Ayotade Ojuawu, all the way from the UK, who has come in line. I had many tracks under me. So Ayotade was on the malaria track and she was being deliberately groomed. And what I was beginning to see at some point were several unconquered territories in malaria. And I was trusting that we will raise many replacement sons and daughters who will fulfill those particular areas. And then we thank God for her. And let me underscore the fact that her dissertation was adjudged the best in her set, which was a work on malaria. And also she was a beneficiary of a training fellowship. I mean, that has contributed also to her stay in the UK, together with the husband who also had the best dissertation in his own time. So you can imagine that they are a power couple. I want to thank Buki, who is on the neonatal track. So deliberately, she was cultivated along the neonatal line. And it was very interesting to have somebody be in the UK and still acknowledging, many times it's the other way around. People go to UK and then or elsewhere, and then they disparage whatever it is that was being done. But for her, each time we have a conversation, I then really appreciated how God has helped us in our journey together. She got a training fellowship from the college, and today she's a certified neonatologist and also practicing happily in the UK. And I want to thank you for your diligent word and kind words to us. And to Olayinka Ibrahim, interestingly, maybe except for Ayotade, Buki and Yinka Ibrahim were captains in their own group. So it was in the process of fixing lectures and when are you coming or not coming. That was how we built relationship that has lasted till this moment. Let me say something. When you are following somebody in mentorship, I'm looking at the time, don't worry. At some point, Yinka was working in Gombe and he needed to advance himself. And we're always discussing about employment down here in Ilorin and all that. And at some point, I said, Yinka, look, you've stayed there long enough. If you need to make the progress you are going to make, if you don't burn the bridge completely, you will always be going back to your limitations. And he had to burn the bridge. I said, you might have to just come, sit down in Ilorin, look for the job you are looking for. Hunger will not kill you. If you don't have a job in 6 months, you will not die. but you'll be able to rechannel your direction and you can move ahead. I don't know whether I can say that even to my blood brother and we just pack his load and take off. But the responsibility of looking after younger people was stronger on me when, on the strength of that word, Dr. Ibrahim left Gombe. He came to Ilorin. I think within about 3 months, he then secured the job. He went on to do a master's in physiology. He has a double qualification of the 2 colleges, and he is now an excellent researcher and who is contributing his quota. So these are all wonderful people. They are a specimen from the pack. As it has been said, there are those who have become professors. What is the driving force? Number one, I want to encourage, there's one word. That word is called mediocrity. Mediocrity, when you listen to it, sounds like a very derogatory word. But in actual fact, the mediocrity or being a mediocre means being average. So in its true meaning, mediocrity is higher than how it sounds in value. It is average. It is not rubbish. It is actually average. But that is one word that you have to decide to fight purposefully, intentionally. You must refuse the syndrome of average. So don't be a mediocre. When they say that, it is not as abusive as it sounds, but actually average is the enemy of better. So don't be a mediocre. Number two, I know everybody is moving around, running around the whole world. I tell people, be led, but you can take a decision based on the following. One, you can choose to be candlelight in a place where there is darkness, or you can choose to be a torchlight in a place that is full of sunlight. Okay. So you can imagine the impact of a torchlight under sunlight versus the impact of a candlelight under darkness. So that is the way you look at it in relative terms. I was in Canada to make a presentation about care of the newborn. And we were speaking, and I admitted up front, it is like bringing coal to Newcastle. But by the time I finished my usual, they need to be pink, they need to be warm, they need to be sweet, and they need to be clean. In Canada, the atmosphere was as if a preacher had entered into town. There was repentance in the atmosphere. So please, nothing is primarily inferior with your brain. Don't ignore your little ideas. You might think because you are having an idea here, then it is weaker than elsewhere. No, jot down your ideas and incubate them. When you are in another environment, be humble to learn in that other environment. But where you are not an inferior person. So I hope we will rather optimize the platforms that we have around us rather than criticizing it to the point of paralysis. You can definitely make a difference. If there is anything that I have begged God to be the story of my life, is that in all ramifications, let it be inspiring. And I want to commit you to God's hand. During my inaugural lecture, I summarized my life as a worm becoming a sharp threshing instrument. And I say, if God can do it for me, because in primary 2, my position was 144, but today, I'm a professor of medicine. So if God can do it for me, he can do it for anybody. Be encouraged. Tomorrow is not hopeless, all right? but don't mark your time by comparison. Use your opportunities as God provides it, and think more about what you can do to make a change than just waiting on the system. It can be frustrating if you are waiting. I'm grateful for this opportunity. I'm overwhelmed by this feedback, and I can only thank God for the grace. Thank you all so much.
Wow, thank you. Thank you. Thank you so much, sir. If you're reading the chat, I made attempt to, drop. Another thing to reflect on is whether candlelight or torchlight. Yeah, so I have enough time to, digest and make informed decision. Let me, at this junction, appreciate everyone who, have participated in this roundtable series. I wanted to ask if we can all put up a camera, if you have a good background, so that we can take a screen picture. I'm sure the organizers will be interested to keep this memory. Yeah. You can see all of us. I'm seeing a lot of people I've seen for many years, just because of this platform. Thank you all. Yeah, so Prof, I appreciate everyone we do as well. So the admin, can you quickly just take the screenshot? Can you take the screenshot?
Just spare me 1 minute to say a big thank you to those who have attended this session. I'm humbled. I have fellow professors. I have classmates in school. I have maybe you are the 10th generation mentee. I don't know. I have people who have become more broad-chested than me, like John, and the way I'm looking at him now. I have my my current research team. And I also have my children, my family, who are equally here. So I may not be able to list everyone, but I'm really, really overwhelmed. Some are sharing platform. I see Dio together on Yinka's platform. So it's amazing. It's amazing. Thank you all very much. You just made our day. Yeah.
Yeah. Thank you, sir. I'll now hand it over to the organizer. I'm seeing communicate. I don't know the format that will take, but from my hand, thank you for the opportunity and hope to come your way some other time. Yeah.
Thank you.
So, Mr. Shegun, you can take it up from here if you're sharing any communique. Otherwise, we'll bring the meeting to close. Okay, so I've been asked to round up, so I think I'm closing the meeting. So once again, thank you all for your patience, and I'm sure one day we'll celebrate you as well when you internalize all these valuable teachings and put it to work in a different sphere of influence. Till we come your way some other time, please do enjoy your weekend, and bye for now. Thank you. Yeah, bye. Bye.
Bye-bye.
Thank you. Bye-bye. Thank you all.
Yeah.
Bye. Thank you.
Thank you, Tari.
Bye-bye.
Thank you.
Bye.
I can hear your voice. Yeah.
Thank you, Prof.
Good
Bye.
to see you, Prof.
Thank you so much.
Thank you so much.
Wow.
Bye.
Damilola.
Bye.
I can see you, Dami. Well done.
you,
Thank you.
Bye. Good to see you.
Okay. Thank you so much. Bukola, thank you so much. I can see you as well. Kwele, it's nice to see you.
Bye, sir.
Well
Bye,
done, Adachi. Thank you. Yeah. All right.
Bye, sir.
Okay. Shetike. Yeah.
Yes, sir. Yes, sir.
Thank you.
Bye.
Yeah. All right. Signing out. Mhm.